Good morning. My name is Eric. Did you know that asthma affects more than 300 million individuals around the world? And in Australia, more than 2 million people have the disease. It is considered a serious health and socioeconomic issue around the globe. Furthermore, there is strong likelihood that it will get worse with more urbanization and modern lifestyle occurring. In this presentation, I would like to refer you to the case study of 18-year-old Jackson Smith. I will cover one of his clinical manifestations, pathophysiology, and recommended a high, a high priority nursing intervention to help stabilize Mr. Smith. Asthma is defined as a chronic lung disease with presence of excessive variation of lung function, variable lung, variable respiratory system, for example, wheezing, shortness of breath, coughing, and chest tightness. The risk factor of asthma are genetically predispositions, and also allergy exposure, living in urban areas, exposure to air pollution, cigarette smoke, exercise, and cold air. Also, reoccurring respiratory viral infections and obesity. Since the illness is not curable, it should be carefully managed and prevented with techniques to help the outcome. In this study, the client presented with diminished breath sounds, widespread wheeze, among other symptoms. One of the nursing assessment tools used on Mr. Smith is auscultation of the lungs. On this of significance in Mrs. Smith's case, the airflow rate had been too low to generate a wheeze, hence widespread wheezes. From the tests presented in the case of Mr. Smith, it is clear that he is suffering from asthma complications and provisional diagnosis of acute severe asthma is made. Mr. Smith's condition is a high priority given asthma's negative effects on the organs, being the lungs, and the respiratory system is one of the primary living systems essential for normal functioning of the human body. When it comes to asthma attacks, all cases are treated as an emergency due to the compromising airways. The consequences of Mr. Smith's immediate diagnosis, if left unmanaged, could result in deterioration within minutes, which may even cause death if not urgently treated. The pathophysiology of asthma differs from one type of asthma to another. However, the end result is still the same: bronchial constriction, inflammatory mucus overproduction that makes it harder to breathe, hence Mr. Smith's widespread wheezing and diminishing breath sounds. Although the end result is the same, it is important to identify the particular pattern of airway inflammation through the assessment of biomarker sputum to provide more effective targeted therapies for the patient. People are known, People with asthma are known to be hypersensitive to certain triggers. The immune system incorrectly considers certain stimulants to be harmful to and respond in an exaggerated way. The airway narrows after exposure to the irritant, causing the bronchial tubes to contract. And this is called hyperresponsiveness. Once the immune system detects the allergens or the irritants in your body, it responds by releasing plasma cells that contain antibody immunoglobulins. The immunoglobulin then attaches itself to several white blood cells, the surface of the mast cell and type 2 T helper cells in the airways. They in turn induce and produce mediators and inflammation and cytokines, including histamines, prostaglandins, leuc- leukotrienes, and interleukins. 4, interleukin 5, and interleukin 13. The vasal effects of blood vessels of these cytokines include a widening of the blood cells and increased capillary permeability. This leads to an increase in blood flow to the area and movement of inflammatory cells and chemicals through the cells and into the connective tissue. Bronchioles penetrate by the eosinophils and neutrophils and the lymphocytes, resulting due to the chemostatic signals. These activate immune cells, particularly the eosinophils, release a variety of chemicals that contribute to the inflammation of airway tissue injuries. The resulting inflammatory process produces bronchial smooth muscle spasms, vascular congestion, edema, and formation production of thick mucus. impaired mucus, impaired mucus clearing, thickening of the airway walls, and increased bronchial hypersensitiveness. The structure and systemized tool in asthma management is using the A to G method for assessing the patient. It is a nursing assessment of airway, breathing, circulation, disability, exposure, further further information and goals. One priority nursing intervention is to place Mrs. Smith in a semi-Fowler position, which is done by placing the bed at an incline angle between 15 to 45 degrees. This is a quick, simple, and effective intervention used for patients who have difficulty breathing. Because in this position, gravity pulls the diaphragm downward, promoting maximum chest lung expansion, enabling the patient to breathe more effectively. To support this nursing action, in 2018, by Samain Najafi, it is reported that oxygen saturation percentage is higher when a patient is placed in a semi-Fowler position compared to other positions, including supine, prone, and high Fowler position. To conclude, given asthma left untreated is usually characterized by chronic inflammation with the potential of irreversible damage to the airways, it is clear Mr. Smith's acute chronic illness requires careful ongoing management. Airway inflammation and severe asthma is highly complex, therefore, research underway to evaluate optimal therapy and treatment for various asthma types. Hopefully, in the future, we can find process to treat progress in treatment and long-term outcomes. I hope you enjoyed my presentation on asthma. Thank you for listening. Bye-bye.